To examine the internal structures of the heart, we're going to have to cut the heart into two halves. This requires a scalpel. So, looking at the heart from a superior view, you are going to make an incision through the middle of the left atrium, all the way down the side of the heart, the left side of the heart, to the apex. You are then going to make an incision through the middle of the right atrium, along the right side of the heart, down to the apex, meeting with your left side cut. From here, you may have to pry open the heart and carefully use your scalpel to cut away tissue so that you create two equal halves. Once you've carefully dissected the heart, creating two equal halves, an anterior half and a posterior half, you can begin studying the internal structures of the heart. So this is the posterior half, and over here is the anterior half. We're going to identify structures on the posterior half. So again, reorienting the heart. This is the right side of the heart. This is the left side of the heart. This is inferior, and up here is superior. So the first structure, or structures that we'll identify, will be on the right side of the heart. This is the right atrium. Right atrium pumps blood through this valve right here. This is called the tricuspid valve. From the tricuspid valve, blood is pumped into this chamber here, called the right ventricle. So let's go back and take a look at the valves. The strings that are attached to the valves are called Chordae Tendinae, heartstrings. The heartstrings are attached to the inner wall of the ventricle through structures called papillary muscles. Looking at the structures on the left side of the heart, we start with the left atrium. Blood in the left atrium is pumped through this valve. You can see the cusps of this valve. This valve is called the bicuspid valve or mitral valve. And again, just like the tricuspid valve, the bicuspid valve has Chordae Tendinae, and the Chordae Tendinae are attached to the inner walls through papillary muscles. From the bicuspid valve, blood then is passed through the left ventricle. Okay? And then from the left ventricle, blood is pumped to the body through this guy right here. This is the aorta. And on the aorta, you have another valve. This valve right here is called the aortic semilunar valve. Now, in between the two ventricles, there's the left ventricle over here. Here's the right ventricle over here. In between the two ventricles, you have this wall of myocardium called the interventricular septum. If you notice a difference between the left ventricle, or the walls of the left ventricle, and the wall of the right ventricle, you will see that the walls of the left ventricle, the myocardium of the left ventricle, is thicker than the myocardium on the right ventricle. And that's because the left ventricle has to pump blood to the whole entire body.